try to resist it. Love is persistent. Your heart knows in spite of your mind.
Welcome, voice friends, to another episode of Interviews on Voice Matters. My name is Liz Johnson Schaefer, and today we're here with Leda Scearce. Did I say that correctly?
You did.
Okay, great. I'm very excited for this interview because Leda is one of the pioneers in the field as far as I'm concerned. She is a singing voice specialist and clinical associate faculty and director of performing programs and development at the Duke Voice Care Center. So thank you very much for being with us today, Leda.
Thanks so much for inviting me.
Absolutely. Absolutely. And just so everyone knows, I need to say this up front, just in case someone doesn't want to watch the whole video. Leda has a brand new text available, Manual of Singing Voice Rehabilitation. I just got my copy the other day. I've only read a few dozen pages of this book, but I've already learned a ton, and I think it's going to be a wonderful resource for everyone in the field. So if you're a singing voice teacher, or you're a clinician, or in the field at all, working with patients, I highly recommend that you get this text. There's a lot of exercise ideas and just how to organize your thinking and working with the singers that we work with. And don't we all want to get better at being able to help people the best way possible? So go out and get your copy. That's my little advertisement for the book.
Thank you.
But anyway, thank you again for being here. And my first question is, how did you first become interested in voice science?
I would say relatively late in my pathway. I kind of went the standard classical singing route. I did a bachelor's and a master's degree in voice at Indiana University, and then embarked on a career singing opera and concert and recital and so forth, and also taught voice at a number of colleges and universities. And really, I would say for that phase of my career, I am embarrassed to say I was not hugely knowledgeable about a lot of voice science. I mean, I took a vocal pedagogy course when I was going to school at Indiana, and I also took a great course with Moya Andrews that was kind of sort of voice disorders for the music school students. So the science was presented in a pretty manageable way for somebody who was not in the speech pathology field. And I was really hooked when that was kind of my first taste of the anatomy, the voice injury piece of it, and I just remember being really interested in that class, but it was very, very basic. So, I kind of knew the fundamentals of anatomy of voice, really didn't know a whole lot about acoustics at all, and so it was much later that I kind of picked up that thread. I made a decision after I had been singing and teaching for, I guess I had been doing that for probably about 12 years, when I just started thinking about wanting to explore other things in my life and just open some other doors in my life. I had always been interested in science and in medicine. And in fact, when I was in high school, kind of the fork in the road for me and going on to college was, do I want to do music or do I want to do medicine? So that interest was always there, and I took the music route at that stage. But the medicine interest had been there for a long time. So I thought about going to veterinary school, and I became a veterinary technician for a while to learn about that. I was a surgical assistant in a veterinary ophthalmology clinic, which was super interesting, and I learned a lot about anatomy and science and medicine kind of on that side of things. At the same time I was doing that, I had an interest in speech pathology too, just as a profession. And I will tell you, at that point, I didn't even know that voice was a piece of speech pathology. I didn't even know that, my picture of speech pathology at that point was, teaching kids to say R, and kind of more the artic side of it. And I thought, I know how to teach diction, so I think I could do that. And so at the same time that I was working in the veterinary ophthalmology clinic, I was taking kind of some basic undergraduate speech pathology courses. And one of the first courses that I took in that first semester was anatomy for speech and hearing. And lo and behold, here's the voice kind of front and center in, in that whole learning experience. And so once I started to understand more about how the voice works, where I kind of knew the geography of it, but much less about the function and the physiology piece of it. So when I started to learn about that, I was really intrigued with that. At the same time, I was taking a speech science course, which really got into more the acoustics and perception piece of it, and I was really hooked on that. So I quickly turned my attention kind of to the speech pathology side of things, and regretfully said goodbye to the veterinary science piece of it, although I'm still a lifelong animal lover. So that kind of was the opening of the door for me. And as I learned that voice was a big part, well, it's actually a very small part of speech pathology, but a significant part of speech pathology, and that I could potentially sort of marry my lifelong interest in singing, voice, teaching, therapy, and science. It just, I never turned back from that point. That really became my objective to pursue.
That's incredible. That's one of my greatest joys in doing these interviews, is hearing how everyone has a winding path that brings them to voice science, or
I love that too.
catch the bug. Mm-hmm. Yeah. And it brings together. And Kitty Vertolini says that, you can come from voice from any angle. And that's so true. Mm-hmm. Yeah. That's what happened for me, was my love for psychology and music, and then science and how the voice works is just this really lovely intersection that for many, many years eluded me. And I couldn't figure out how these pieces fit together. And then voice is where it all kind of gels, It
is really amazing.
Yeah. So how did you end up in your current position working in a clinical setting? I mean, obviously the medicine was a thread throughout your whole life, and the science part of it was an interest, but how did you end up in your current position?
Yeah. So when I was taking those prerequisite courses, the undergraduate courses that I would need to start a master's in speech pathology, I knew that voice was going to be a central part of that study for me, but I was really interested in the whole profession. There are many, many parts of speech pathology. I could see myself ending up in another area of speech pathology and having a fulfilling career there. But I knew I really wanted to pursue voice. So I started a master's degree at Boston University, and I knew that I would be doing a clinical placement in voice at Mass Ioneer Infirmary at the Voice and Speech Lab there. That was my third semester of school when I started that internship, and the off-site internships that you do as a speech pathology student are pretty intensive, and it's usually pretty much full-time. You go there every day. I mean, it's a working week pretty much. So I remember the first day that I walked into my internship at that clinic, and I just felt like, oh yes, this is where I belong. This is my purpose. This is what I want to do. And so that once I started that internship, that really became a very clear pathway for me. So the next semester I graduated from BU, and had to start thinking about jobs. And I had lived in North Carolina in the 90s. I came here to sing with the National Opera Company, which was a touring repertory opera company. And I sang for 2 seasons with that company here in Raleigh. We were based in Raleigh, but toured all over the country. And I just fell in love with this part of the country. I fell in love with the landscape here, and kind of the people here. And so really made a very heartfelt connection with this place, and then went off on this peripatetic pathway and lived in Hawaii and Western North Carolina and Texas and Maine, and all of that time I wanted to come back here. So right after I graduated, I had an opportunity to come back here. And at that time, there was the only voice center in this area was at University of North Carolina at Chapel Hill. And I knew the person who did voice at that clinic, and I contacted her, and she said, well, I don't see us opening up a position, our positions are filled, and I don't see us adding one, and nobody's planning on leaving. So then I kind of thought, okay, now what do I do? And I thought, if this is going to happen anywhere, it's going to happen at Duke. Just knowing sort of Duke's reputation, and it's a huge medical center and a very cutting edge, state-of-the-art medical center. And I thought, okay, let me see what's going on there. So I applied to the speech pathology division here, and the position that was open was in pediatric speech pathology with preschoolers, which was like I had no experience from my graduate work with that population. Even the work that I had done with children was like the youngest age I worked with was kindergarten. So I really was out of my, definitely out of my bailiwick a little bit. And when I interviewed for the job, I told the person who was interviewing me, I said, look, voice is my passion, and that's really what I see myself doing. And I'm going to continue to pursue that interest. I am definitely willing to try working with this other population and to expand my skills as a speech pathologist and develop there. But it's just important that that voice is where my heart is. And they hired me anyway, knowing that. And so that was a really interesting process, and I'm really grateful for it because I did start out working with preschoolers and learned so much from that experience, something that I never would have pursued without that push. But I learned a tremendous amount, and I ended up for the first year and a half that I was here at Duke really working with a lot of different populations. So I ended up working with kids kind of through the whole age range in all kinds of speech and language problems, stuttering, articulation, language delays, but also working with adults with aphasia, with traumatic brain injury. So I got a very well-rounded experience in speech pathology, which I'm very grateful for. Very soon into my time here at Duke, I met some of the doctors in the ENT division, the head and neck surgery division, and there was one doctor there in particular, David Witzel, who was really interested in getting voice off the ground at Duke. And up until that point, it had been kind of a sequential model. So voice patients would come to the ENT division, which was a whole separate division, and they would see the MD there, and then the MD would refer to our division for voice evaluation and for therapy. And that's a little bit of a clunky model because, a lot can happen between that MD appointment and the speech pathology appointment, and sometimes patients can have a hard time understanding what's this and why am I going to speech therapy, and so it can delay care. Sometimes people drop out because they don't really kind of understand why they're going to do voice therapy or what that's going to do to help them. So we weren't happy with that model of things, and so Dr. Witzel asked me to collaborate with him and with the ENT department on kind of making a center where we would do a more interdisciplinary, holistic team approach to voice care. And so the Duke Voice Care Center was born out of that collaboration almost exactly 11 years ago. And we have continued to just expand and grow since then. So I'm just so, I feel incredibly lucky and incredibly grateful that just kind of sequence opened these doors for me. And I have my dream job. I remember being up there at Mass Eye and Ear Infirmary and, kind of envisioning what is this dream job that I want? What would it look like? And honestly, the job that I have so far exceeds what I could even have imagined at that point. Because I'm doing the work that I love with singers in a clinical context, but I also have a lot of teaching opportunities. We do a lot of community outreach, a lot of community education, a lot of prevention work, and I love that part of it. And so I feel very lucky and grateful that I have kind of found my purpose in life.
What's a favorite part of your day?
I was going to say, that's hard to answer because there are so many different things that I enjoy, but I'm going to cancel that and say it's actually really easy to answer, because the favorite part of any day is when there's a moment of connection with another person. And, sometimes that is in a teaching context or in, working in the community. And sometimes that's in a clinical context, but that moment where there's someone who is seeking, and whether that's seeking knowledge or seeking recovery from a voice injury, they're in a position of seeking, and if I can, in a small way, help them to get what they need at that moment to reach what it is that they're seeking, that's an incredibly powerful and moving and fulfilling thing. So it's those moments of connection, and it might be the moment where they kind of go, oh, aha, and they understand something about the mechanics of the voice that they didn't understand before, or it might be the moment when they break down in tears because they have a diagnosis of a voice injury and they're scared and they're worried about their voice. And, I can say, I know how you feel. I know exactly what you're going through, and we can help you, and you can get on the other side of this. To be able to, to offer that aid to someone else is absolutely the most fulfilling thing for me.
That's beautiful. You're speaking my language. That's what I enjoy about my job the most as well, is just that moment of aha or change or shift. And yeah, that's wonderful. And that is a really nice segue into part of your book, which addresses a whole chapter that addresses a psychology of singing voice disorders more specifically, I believe. As most of us know, when there is a voice disorder, that can be a very complicated emotional time. And one of the things that you address in your chapter is that we need to stop the blaming. We need to stop blaming patients for, having a vocal injury or talking about abuse on the voice. And I was just wondering how you think about that when you're working with your clients.
Yeah, thank you for bringing that forward, because that is one of the most important things. I feel one of the most important things I can do as a vocalogist and particularly as a clinician is to kind of change that culture. I was definitely taught explicitly that this whole concept of vocal abuse, that term, and that if you get nodules, that's the worst thing that can happen to you, and you're ruined and damaged, and you did something to make that happen. So there's tons of blame in that whole framework. And I certainly, early on in my teaching career, that was still part of my belief system. And as I shifted to the clinical side and really started to kind of see what people went through when they have a voice injury, I began to question that kind of terminology and that language. And then sort of looking around at the wider world, when somebody gets carpal tunnel syndrome from typing on a computer all day, we don't call them a hand abuser. And we don't say that injury is a result of hand abuse. We say it's a repetitive stress injury, which is obviously connected to the work that person is doing, and there's a pathway to healing from that. And that particular analogy I find really helpful in talking to doctors, because doctors use that terminology, that vocal abuse terminology as well. Pianists get tendinitis, and again, we don't say that's hand abuse. Athletes get knee injuries and hip injuries, and we don't call them, we don't say that's abuse. They put superhuman demands on a human body, and that's a recipe for injury. And it's the same thing with singing. We're asking our human anatomy to do this incredible superhuman thing. And just like with athletes, there's a potential for injury there. And so when that injury happens, to just accept that as something that's in the course of what can potentially happen when you have super heavy vocal demands, when you have a really vocally demanding career, let's say. So framing it that way just really takes that whole element of blame out of it. And it's, when I talk to patients about this, often there'll just kind of be this relief and just hearing that, oh, it's not my fault, I didn't do something wrong, because they're really thinking in those terms. And there's the stigma is so entrenched and so ingrained. Sometimes I'll work with very high level elite singers, and they don't want anybody to know about it. We've had singers who've used pseudonyms in the clinic so that they don't even have a medical record in their name, in order to avoid, anybody finding out about it. So, and that's part of the problem, right? Because then you have these high-level, elite, famous singers that everybody knows, and people look and say, well, those people don't get injuries, but they do. They do a lot of the time. It's just often is not talked about, particularly in the classical realm. So it's really important to me to encourage all of us, singing teachers, singers, doctors, speech therapists, to kind of move away from that language and kind of reframe the way that we think about that. The language we use guides our thinking as well. So if we have that terminology in our head, oh, vocal abuse, vocal damage, then we're kind of thinking about it in that pejorative way.
Yeah.
If we can change the language that we're using and change our thinking, it's more accurate. Mm-hmm. And it also just paves the way for a much more fruitful outcome for the patient.
And that brings me to my next question, which is, how do you feel that the concept of being a vocal athlete has helped your clients? Because this is a new term we have over the last few years. It's really come to the surface, and in all the vocal science circles, people are talking about vocal athlete, which is wonderful. And I have clients that come to me who have never heard that term. And like you're saying, it brings them so much relief, because then they start to make the connection between their physical body and the physical act of singing. Have you seen that be a helpful tool in your practice?
Absolutely. Absolutely. We're a very sports-oriented culture, and people get that. They get, oh, wow, athletes, they have to do these incredible things, and they have to train, and they have to be disciplined, and they get hurt. And so that's just a really salient analogy for us. And there's a direct line to singing. So much of what we know about sports medicine and just kind of exercise physiology in general can apply to the voice. We're way behind the sports people in terms of the direct study of that, and it's more challenging to study that in the voice. But that's a very relevant and applicable pathway, and it does make a lot of sense to people. We tend not to think of it that way, because we all have a voice. We all are using our voice from the moment that we're born, and so it's possible to sing without going down kind of that athletic training pathway in a way that nobody's going to the NBA without having any training, right? But there are people having really high-level singing careers who have minimal or no training. So because it's possible to do that, people don't necessarily think of it in parallel with what athletes have to do in terms of preparation. But it's very applicable, and I do find it a super useful analogy, and not just for singing either. Ingo Tietze is talking a lot now about kind of exceptional voice use above the level of the conversation that we are having. So whether that, obviously that's singers and actors, but clergy and anybody who has to project their voice routinely in their day. Somebody who's a drill sergeant is a vocal athlete, right? So there are lots of other contexts for that concept where that concept can be applied.
So my question now is, how did this wonderful text come about? What was the inspiration for it?
The inspiration was a woman named Brenda Smith, who is a choral conductor and singing teacher in Florida, and kind of part of the editorial team at Plural Publishing, nagged me for 2 years. Let me rephrase that. She invited me to think about writing a book, and initially I was like, that's not on my radar at all. And I thought, I'm not capable of writing a book. And she kind of just kept working on me. I would see her at conferences all the time, and she just kept working on me. And it kind of, eventually I started to think, well, maybe. And I wrote a chapter and kind of went through the process at Plural, and they wanted me to write the book. So then, oh my gosh, now I have a contract and I actually have to do this. But it was an incredible experience for me. And again, I find that has happened a number of important times in my life where, something came along that I would never have thought of myself, or never would have embarked on myself. But an invitation was opened, and I followed it, and it ended up being a really incredible, in many cases, life-changing experience. So I'm super grateful to Brenda for nagging me, and really grateful to her for seeing a potential in myself that I didn't necessarily see. So it was a great experience.
That's wonderful.
A difficult experience. It's really wonderful to be on this side of it, but I'm really glad I did it now.
And how long did it take you to finish the book?
Let's see. It was something that was kind of stewing for a long time. So I would say the stewing stage probably, I would say the stewing stage probably like a year and a half. Mm-hmm. But in terms of when I actually sat down and started writing, I think it was probably about 9 months.
Okay. Excellent.
9 months to turning in the manuscript. Actually had a really severe injury kind of in the middle of this whole thing. I was in a bike wreck, and right before the contract came from Plural, and I had a pretty significant head injury that I didn't realize how bad it was at first. So that kind of sidelined me for a little bit. So I had intended to start writing the book right when that contract was signed, and it was really it was about 9 months before I could dig into it because I was recovering from this injury. I actually talk about that injury in the book because it was an awful thing to go through. But it just gave me so much perspective on what it is like to get hurt and to be sidelined and to not know if you're going to get better, and to have to go through a long process of recovery. And that has impacted my therapy ever since that happened. And, I have always tried to approach every patient in every moment, every session with compassion. But it's different when you go through an experience yourself. So the way this manifested is I started developing really bad headaches, kind of crippling headaches, about 3 weeks after the injury. So I was really smashed up at first, like the whole side of my face, so kind of the first few weeks, it was just all about kind of the visible stuff. And as that healed, I started having these really debilitating headaches, and I wasn't diagnosed with a concussion in the emergency room, but I did have one. And so I didn't get the right treatment right away. So it kind of took me a while to get on the right pathway of treatment. It was actually a physical therapist, a behaviorist, who got me to the right medical people to treat it. But really the prescription was rest your brain. And so anything stimulating, screens, sound, reading, any kind of stimulation like that could set off the headache. So I had to really pare down my work schedule. I had to, measure my screen time and have a timer go off after 10 minutes of working on email and rest. And it was really hard for me to do the rest. And, I get to a point where, okay, things are doing better and I'm feeling better. And then I would zoom back into it. And then I'd get worse again. And so I kept having these setbacks, which is exactly what happens to my singing patients. They have an injury and, in many cases, rest is not complete rest, but periodic, planned rest is part of the recovery. And for someone who's a music educator, using their voice all day long, or a professional singer with a career on the line, that's a really hard thing to do. And they go through the same thing. They'll rest for a while and they'll be really good about the vocal pacing, and then things will start to feel a little bit better and they'll overdo it and they'll have a setback, which is exactly what I did with my brain. And so going through that experience just gave me a whole new appreciation for how hard that is.
That's incredible. You talk a lot about vocal pacing.
Mm-hmm.
That's one of the concepts I'm noticing in your book and some of the online resources associated with your name. And I was wondering if you could speak to that a little bit.
Yeah, thank you again for bringing that up, because I have found that to be a much bigger part of the work that I do than I imagined setting out. As a professional singer, I kind of intuitively knew that I needed to do that. And when there were times in my career where performances would kind of overlap, or there was a lot of repertoire to learn, I was cognizant of sort of planning and arranging my practice schedule in a strategic way to not overdo it. Mm-hmm. So I certainly was aware of that concept. But when I started doing voice therapy, I would say at the beginning that was not a huge part of how I worked with patients. I worked much more on kind of the mechanics of voice use and optimizing sort of the vocal exercise regimen. And then as I continued to work with people, it just kept coming to the surface that their progress was really affected by how successful they could be in balancing voice use and voice rest, which is really kind of what that idea of vocal pacing is about. How much you're using your voice, how intensely, in what situations. And so that started to just become a bigger part of how I interacted with patients, and a bigger part of the treatment plan that I would design for them. And to the point where sometimes I will spend an entire session with a patient just working on that goal, going through their schedule, color coding, planning, making lists of the situations they're using their voice in, prioritizing them, numbering them 1 to 10, which is the most important. What can we cut out? What can we cut out in the short term and bring it back later? So just in a very systematic, strategic way, laying that out and just seeing real results from that. As a singing teacher, which I bring that into every session, that part of my background. So initially, the idea that we're going to spend a whole session and we're not going to do anything vocal, and it just felt this doesn't feel right to, to not be going through some exercises or working on, some vocal eases as a part of this. But that was part of my learning process is, hey, sometimes we need to focus on these other things, and that's going to actually benefit the ability to do the mechanical piece of it.
Yeah, that makes a lot of sense. And my last question is, do you have any interesting recovery stories that you could share with us that may instill hope or inspiration for folks who are maybe in the middle of their process right now? Maybe an outcome that was interesting or some way to demonstrate how resilient the body is?
Wow, a number of them come to mind. I guess often the ones that stick with me are the ones that I learned a lot from myself. And so thinking about that, yes, there is a singer that I worked with a few years ago, Grammy nominated, who had kind of this sort of slowly evolving voice injury over a period of a couple of years. She started out with a little bit of edema, and sometimes it would kind of flare up and it was clearer. There was a little more structural change, kind of in the polyp direction, and it would kind of flare up, and then it would kind of settle down a little bit. So we did a little bit of voice therapy, and then kind of the series of events happened. She was sick for a while and kind of had to go ahead with some performances and didn't feel like she fully recovered from that. She did a tour in China and was exposed to some bad air quality and was having to perform in environments where the air quality was bad and kind of coughing and reacting to that. And the performance load went really way up. She had recording contracts, and, it would be wonderful if our singing careers would just have this nice, smooth, steady line of work. But, it rarely works that way, right? Everything comes kind of in a cluster, and a lot of times they're really significant and professionally important things. And so she kind of had a cluster like that, and just slowly this injury started to get worse, and the polyp became more defined and bigger, and she had a hemorrhage at one point. And so this injury just kind of slowly exacerbated. So at one point, the recommendation, she was not getting where she needed to be with just therapy. So that's the point where our laryngologists start thinking about surgery as a possibility. So she had a surgery to remove the polyp, and then she had a really, really difficult recovery from the surgery. So typically, and laryngologists vary in their recommendations for voice rest after surgery. Our laryngologists recommend 1 week of complete voice rest after a microflap surgery like that, and then kind of gradually resuming voice use. Well, during that 1 week recovery period, she got sick. So she had a cold, she was coughing, she was going through an extremely difficult emotional event in her life. And, when that happens, we can't control how we respond to something emotionally. And so it was really a heartbreaking thing for her, and she was crying because of this situation. And so she had a hemorrhage in that first week of recovery. So when she came back for her post-op appointment, the cord was full of blood, basically. So that prolonged her recovery, and we just kept doing the strobe like every 1 to 2 weeks, and that just really took a long time. At one point she re-hemorrhaged, so it got a little bit better, and then she hemorrhaged again. So that there was just a lot of vulnerability in that vocal cord where the surgery had happened. And so it really was maybe 5 or 6 weeks after her surgery before the hemorrhage fully resolved. And, at that point we had planned on, okay, 1 week of voice rest, and we start voice therapy, and we start exercising. So our plan was 6 weeks after her surgery, we'd be well into the rehabilitation plan. We were just barely able to start that. Meanwhile, she's got gigs that she has to cancel or reschedule, and she has to keep pushing her performing schedule out, and there's a financial impact of that, an emotional impact of that. So it just really just kind of spiraled for her, spiraled downward. And then because of those events in the post-op period, that vocal cord did not look great. So the hemorrhage resolved, but the vocal cord was very stiff. It looked like some scarring had happened as a result of all of that. So I think the significant thing about this story is that in my mind, I had a question about how much she was going to regain, how fully she was going to regain. We started on the therapy process, and it was one of the longer therapy protocols. I mean, I would say we went for probably 15 or 16 sessions, which is longer than what we would usually do. And it was very slow for her and very, very small gains. So there was still that sort of emotional response to, okay, so I've got a whole step higher than I did 2 weeks ago, but still here's an octave that I previously had that I can't rely on now. And it was just a very slow recovery. She got back into performing. It was really shaky at first, but she just continued to get a little bit better and little increments, and was able to kick her performing load up a little bit and slowly kind of get back into what would be a normal performing schedule for her. And that cord recovered a lot better than any of us thought it was going to. So it's probably been a year since I've scoped her, but it was much more pliable. I mean, it's always going to be different than the other cord, but much more pliable, good edge, good closure, good vibration. And she just finished 2 recordings at the same time. So she just recorded 2 albums simultaneously over a period of about 6 weeks, with performances thrown in there, with teaching, and has just made a complete recovery. And she sounds better than I've ever heard her sound. And I mean, I heard her sing a number of times before she ever had an injury, and she just sounds amazing and so strong. And she's recovered. There's the physical injury that happens that has to heal and recover, but for singers, there's a huge injury to your confidence. Mm-hmm. And that has to heal too. And often that is the longer process of healing. You're questioning if what your voice is going to do. Is it going to recover? Is it going to be better? Am I going to go back to having this problem again? And I saw I saw that confidence injury in her initial performances when she first started getting back into it. And this show that I saw last month, that's completely recovered too. I mean, she was just strong and solid and sounds amazing. So that's kind of a benchmark for me. You know, when I see an injury that's, I'm thinking, wow, this is pretty severe. I'm not sure. And I don't want to paint this as kind of this Pollyanna-ish,
Right.
oh, any injury can recover and there's always hope. Because sometimes that doesn't happen.
Right.
And people have to kind of adjust and make changes. But that was a case where I had a question in my mind and she recovered better than I thought was going to be possible based on how she looked after that series of events.
Wow. Well, that's wonderful. Thank you for sharing it, because I know there's going to be somebody out there who sees this video and has a little bit more hope. And I know it doesn't always go the way we want it to, but the body is resilient, and I hang my hope on that. And I'm an eternal optimist, for better or for worse. And so I always like to think that there's a chance. And, you know, there are times, like you said, when you have to make adjustments and change. And that's a really, really tough process for people to go through, is to get used to a new sound or have to live with something that doesn't feel acceptable anymore. So, but it's good to know too, that there are times where things happen better than we think they're going to.
Yeah. And really kind of the whole, the recovery, the circumstances of the recovery are really significant for that. So, you know, the patient has to really be on board. The clinician really has to know what they're doing for that outcome to happen.
Yeah. Well, thank you so much for your time today. This is a good time to stop so we don't go too much longer or take up too much more of your time. But as I have better and more questions, would you be interested in talking with us again and sharing more ideas?
I would be happy to.
All right. Well, thank you so much. And hopefully we'll talk with you soon.
Thank you. I
All
look
right.
forward to it. Bye-bye.
Bye.